You brought up this idea of resilience. Mm-hmm. I'm curious if there's patterns or traits in people that you notice that are especially resilient.
I think every day in my work, I am impressed by the varied ways in which people find resilience, even in the most challenging of circumstances. And I think it could be so different for each person depending upon where they are in their cancer experience. Mm-hmm. But I do think that there is something about connecting to what is important to you and what you value that helps you navigate the cancer experience. Knowing what aspects of your health matter, mm-hmm. right? Knowing what parts of your life are important enough that you don't want to sacrifice, that you want to still continue to live in line with. I find that people who are connected to what is important to them, it helps them navigate the very difficult nature of making treatment decisions, right? Mm. And that's not to say that people don't know what's important to them, right? But I think the uncertainty of cancer often joggles that a little bit. It makes people think differently about how do I want to spend my time? Who do I want to spend my time with? How do I want to make meaning? How do I want to understand this experience I'm having? And I think for individuals who are able to confront those difficult questions and allow themselves to experience that discomfort and explore that, I think it helps you connect to what's important, which ultimately helps you make decisions for your care that's going to most align with what's important to you.
I think that's really interesting, something that I've never really thought about before, especially with that population. But really any chronic illness that you get diagnosed with is potentially fatal, right? You start asking yourself those questions, I would imagine, that you've never really had a reason to ask yourself before. Who do I want to spend time with? All right, I have 6 months left maybe. What do I want to do with that time? What's important to me? Sorry,
yeah, I think it's a very unique experience, and not one that you can prepare for prior to being diagnosed with a life-threatening or life-shortening illness, right? And so I think that in those difficult thoughts, there is actually a lot of opportunity for growth and to find what it is that is important for you, even if that exploration is really challenging.
This might be the part of the conversation where I need you to educate me a little bit. There's all different kinds and severities of this illness, right?
Yes.
So I would imagine that for some people, where the prognosis is really good, really positive, getting the news that they have cancer might hit them differently than someone where the prognosis is really not great. And I guess what I want to ask is what do you see the differences are between those two, the prognosis? How much of a difference does a prognosis make in how they might think about this?
It's actually a very interesting question because I think that multiple people can have the same prognosis and have very different emotional reactions, right? Let's think about breast cancer, for example. I think we have made leaps and bounds in how we treat the medical side of breast cancer, right? Caught early, you maybe do surgery, maybe some chemotherapy, radiation, you go on long-term maintenance medication. So for cancers that are estrogen positive, they might be prescribed a long-term hormonal medication that they'll take for 5 years. But they're in remission, right? There's no evidence of disease. They're living without cancer. They have a good prognosis, right? Yeah. Whether or not you have a good prognosis does not take away the uncertainty that comes with knowing that you once had cancer and it can come back. Having a prognosis does not take away the long-term side effects that come with either having cancer or its treatment. I think breast cancer is a very interesting or complex experience, I should say, in that even when you're no evidence disease, but you're taking these long-term medications, that's 5 years of your life where you might have hot flashes, joint pain, sleep disturbance, mood swings, really difficult symptoms to not only manage, but reminders, everyday reminders of the cancer experience that you've had.
Good point.
Right? And so I think that prognosis is a very interesting concept in that for some people, prognosis brings a lot of meaning or security. Someone might say, I have 6 months to live and I know exactly how I want to spend it. I've lived a life that I'm proud of and that has been meaningful, and I am ready for this next phase. And then you might have someone who has a very long prognosis but is struggling with very different experiences. And so I think the most important aspect of the care that we provide is meeting patients where they're at and tailoring the work that we're doing. One day it might be developing concrete coping skills, and the next day it might just be creating space to process what's a very difficult experience.
Yeah, good point. You brought up this idea of uncertainty. And that's where anxiety is going to play in any amount of uncertainty, right? And the other thought I was having is you brought up like these side effects you might be having from, let's say you're on a long-term medication, but you're cancer-free, but you have side effects, hot flashes, sleep disturbances, whatever. And what anxiety is really good at is finding any reminder to bring your mind back to that thing. It was something you said. You said, oh, you may have this constant reminder of. And then the uncertainty can kind of work its way in. And then next thing you know, your mind's back on that train of thinking about it, right? So I guess I was just struck by how many opportunities there are here for anxiety to kind of work its way in, because there's kind of now this looming uncertainty, and you may or may not have like daily or weekly reminders of it, right?
Yeah, I think one of the most helpful things when it comes to managing like anxiety and uncertainty is psychoeducation around why that's happening, right? So we hear the word anxiety, right? And we think to ourselves, okay, we want to get rid of it, right? We don't want to have anxiety, it's bad, right? But anxiety is actually a very important thing. It's evolutionarily adaptive. If you are not worried about your well-being and safety, right?
You'll be dead in
3
days.
It's going to be a dangerous situation, right? And so I try to really normalize that these negative emotions that you have are adaptive. In a lot of ways, when you felt that discomfort in your body and you worried about it and you sought care, that's what got you the care you needed.
Correct.
We don't want to erase that entirely, right? I think about emotion as being on a spectrum. In its healthiest forms, something like concern and sadness is helpful, beneficial. But in its most severe form, something like anxiety and depression is less helpful, right? It gets in the way of doing what we need to do, right? And so I think a lot of the groundwork is that emotional education, right? That it's actually okay to feel negative emotion.
Right.
It's very important to feel negative emotion. It's how we feel it and what we do with it that matters.
Yeah. So like in that case of someone with these long-term kind of side effects from this medication they have to be on, what would your takeaways be for them in terms of how to manage the anxiety that might come along with that?
Yeah. So I think first there's a lot of processing around what that feels like in your body, because also anxiety is very different from person to person. One person's anxiety might be really physical, right? That tenseness you feel in your body, that tightness you feel in your chest. So often I also hear like, well, I don't really notice anything in my body, but my brain does not turn off 1,000,000 miles a minute. I can't think these thoughts straight, right? When we start to understand what does that symptom feel like for you, we can implement evidence-based techniques to manage it, right? So for someone who finds themselves thinking all day about the cancer experience, the what ifs, the what next, we might start with something like mindfulness. How do we first identify when it's happening in the moment, become more adept at noticing when the brain is starting to speed up? How do we sit and tolerate that without having to change it, fix it, solve it, right? Let's first notice when it's happening and sit with it. Once we build up that skill, then we can start thinking, okay, what are some of the thoughts that are especially sticky? The ones that no matter how long you sit with, they keep coming back for more, right? Let's take a look. Are these thoughts true? do they just feel really true, right? Is there an alternative or a more helpful way to consider that thought? Each step along the way, we can build up a skill. Because ultimately, our goal is not to stop you from ever having a thought again.
Right.
Or to stop you from ever having an
Good
emotion
luck.
again, right?
Mm-hmm.
We have a bajillion thoughts a day that we don't think twice about,
And
right?
when you try not to think about one.
Don't think about the purple elephant,
that's
right?
right,
You
yeah.
can't help it. So our goal is, okay, we've figured out that there are certain thoughts that are really hard to let go of. If those thoughts are always going to be there, what do we want to do with them? And again, that balance is struck of validating, yeah, it's really hard
Right.
that now this is something that pops up that's never happened to you before,
Yes.
right?
And uncomfortable.
And uncomfortable.
Yeah.
But discomfort can be okay.